Hi, Megan. Welcome. How are you today?
I'm good, thanks. How are you?
I'm doing well. Did you find the place okay?
Yes, I did.
Awesome. That's amazing. So before we get started today, we just got to go through some paperwork. So that typically will take up the whole session, and then we can set our goals and intentions for our following sessions. So can you tell me if you've ever had any previous counseling before?
Yeah, I've done it a few times.
Yes, you want to tell me a bit about it?
It's usually gone pretty well.
Mhm.
I had one experience in middle school that was a little iffy. And yeah, I didn't really enjoy that experience too much, but after that one time I've had really good experiences altogether.
Okay. Is there any, do you want to tell me about that experience, or is that something that you don't really like to talk about?
Yeah, it's not like a sensitive situation, but I just think maybe the counselor and I didn't click very well, and there was some misinterpretations of them trying to gather information and not fully listening to me, I guess. So, but yeah, other than that, it's been great.
Good. Well, I'm glad that that didn't turn you away from seeking out more help, and I hope that our relationship can be different than that. But thank you for sharing that information with me. So with your previous experience with counseling, do you have any questions or concerns for me before we get started?
Nope.
Okay. All right. Well, like I said, we're just going to go through a bit of information before we get started. So the first session, I'm going to tell you a bit about myself. We're going to go through informed consent and a confidentiality form that I have. And then we're also going to do some assessment sheets. I've got about 18 questions that I need to ask you just to see what it is you want to talk about and see where we're at in the helping process.
Totally.
And that can lead to some unpacking. And then, like I said, that will probably take up most of our time, so we can set some goals and intentions for our next sessions.
Totally.
So a bit about myself. I am a registered clinical counselor. I have been counseling for about 4 years. I have a bachelor's in child and youth care and then a master's in RCC. And I've got a really cute dog. Is there anything that you want to know about myself? Okay. So we can start off with this confidentiality form. So I'm just going to read off of this form, these two forms here, and then I'll just get you to sign it, and then if you have any questions, we can open that up for you. So welcome. My services to you are voluntary and confidential. All the counselors take seriously the need to safeguard the privacy and confidentiality of personal information that you provide to us. I will not release any information about you or your family to anyone else unless you sign a release form. However, there are 4 limitations to this confidentiality, which include that by law, I have to share information if you share with me or I suspect that you or a child have been abused or neglected. This includes physical, emotional, mental, or sexual abuse. You share or we suspect that you intend to hurt yourself. You share with us that you intend to hurt anyone, another person, or your actions or knowledge may potentially harm others, or I receive a subpoena to testify in court. People may share information which will include the MCFD and family, or MCFD, the police or other emergency services, or for above information, as well as I can share information with my supervisor if I ever need some clarification or another perspective on something that is brought up in session. So all the information that you share with me, I will keep it to myself. I'll make case notes So keeping a paper file on information we'll share with as such as your plan, goals, and needs along with the forms we fill out with each other, which will be the ones that we do today. This information can come from a variety of places, including face-to-face conversations, phone calls, text messages, social media. These are securely locked in a filing cabinet and behind locked office doors. Keeping some of your information on a secure database system. This database helps us collect statistical information to evaluate our services. And then our agency uses a collaborative case management approach, which helps us plan for your success. This means we receive support, feedback, and direction from our supervisors, like I just mentioned, and from the other counselors in the program. For this reason, we ask that you provide consent on the next form to follow us, to allow us to collectively plan for you. And we can do that in just a moment. Are you okay with that information being shared? All right. So if you ever want to access your information, you can just specifically ask me, and I can pull up any of your case notes or any information that's been shared within the agency. And just so you're aware, no one outside of the organization has that information. So before we move along, I'll just need you to sign and date this bottom of the form there.
And what's the date today?
October 10th. Thank you very much. All right, so as I just mentioned, I quickly went over some of the limitations to confidentiality, and now this form will kind of go into the benefits and further limitations of our relationship. So can you tell me any benefits that you've had from having counseling sessions?
I've done a couple of different types of counseling. So I've done just like regular talk therapy. I've done like family counseling, and then I've also done EMDR therapy, and they've all kind of helped in different ways. Talk therapy I found is really helpful, just like almost to help me kind of like mull through all the things going on in my brain, and then by the time I leave, I feel just like a lot more clarity about like how my life is going, and like I usually feel more upbeat about myself, and I'm less like down on myself. But the family counseling obviously helped with family struggles we were having,
right?
And then my EMDR just really helped me move on and accept traumas that I've been through.
Okay.
So yeah, between the three of them, it's helped a lot.
All in different ways.
Mm-hmm.
That's great. So for the talk therapy, I heard you say that you found to be the most beneficial. From what you were saying, I understood that it helped you kind of lay out a picture of everything that was jumbled up in your brain. Is that correct?
Yeah.
So did you find that your previous counselors would write things out for you, or just more so speaking to what was being brought up?
My talk therapy counselor would tend to just speak to things that were brought up, but I have had like my EMDR therapist. She would write diagrams and draw pictures of things just in like a notebook, and to show kind of how things are linking, or when she would try to explain theories that might help me like understand why I'm doing certain things, she would draw them out, mostly when she was kind of like connecting emotions with behaviors and feelings.
Right.
And I found that pretty cool. It helped me like really kind of engage more with what was going on.
Okay, awesome. That's really helpful because obviously I'm here to help you, so I want to learn the techniques that will be of best service to you. So going into what my informed consent agreement here says about benefits and emotional risks, It states that majority of individuals, couples, and families that obtain mental health services benefit from the process. The therapeutic process is generally quite useful, but some risks do exist. Over the course of counseling, some experience unwanted feelings. Explaining issues may produce unhappiness, anger, guilt, or frustration. Sometimes participants disclose information that produce discomfort, and important personal decisions are often an outcome of counseling. These experiences likely produce new opportunities as well as unique challenges. Sometimes one will view a decision as negative that is viewed as positive by another family member. Don't hesitate to discuss treatment goals, procedures, or your impressions of the services that are being provided, especially if you experience unexpected discomfort. So this will be a good area for us to paint the picture that's going on in your head, and we can talk through something that you might find as a challenge, and then I can help support you see it as a strength and work from it to help improve. So as I mentioned before, there's the 4 limitations of confidentiality. Before I mentioned that, did you have any knowledge of what confidentiality meant?
Mm-hmm. Yeah, from my past counseling.
Mm-hmm. So can you tell me a bit about that?
Basically that breaches of confidentiality can include, like, if I'm going to do harm to myself or do harm to somebody else. I don't know. If there's harm that's going to take place towards anybody.
Yeah, for sure. That's definitely it. Harm to self or others is definitely the major breach to confidentiality. So like I said, if I have to be subpoenaed or harm to self or others, or if there's been any information brought up about any abuse that you've been exposed to, then I will definitely be speaking to a colleague or MCFD or the police. How do you feel about that? If something is brought up, are you comfortable with that?
Yeah.
Okay. So as I mentioned, I do have a supervisor, and if I do feel like I need to share any information or talk to my supervisor about anything that I might be out of my realm of education, then I'll speak with them just to get another perspective, and then they'll be able to help me. But they'll never sit into a session unless you say so. This will all happen on my own time, and I will most likely tell you that I will be speaking to them, or I need to educate myself more on the topic so that I'm giving you appropriate information rather than false information. Is that okay?
Yep.
Okay. Moving forward, as I stated, all the case notes and everything will be in a filing cabinet. And if you ever want to access those, feel free to ask. You're more than welcome to look at them. But consent will need to be provided. If you ever want to reach me outside of counseling sessions, you have my email. Feel free to call the office. I'm always willing to speak to you about anything that's brought up, and if you feel like you want to see me more than once a week, we can definitely arrange that. Which leads me into my assessment form, just getting contact information and then reaching out about everything else. Does all the confidentiality forms sound okay? All right, perfect. So my printers stopped working, so I'm just going to have to read off of my computer for the assessment form. And for this part, I'm going to be writing down the information. Is that okay?
Yeah.
All right. So, the first page, I'll have it, but the rest is on my computer. So, name. And that's me. So, who is your legal guardian?
I am 19, so
Okay.
of age now.
Right. So I'm actually going to use this one because this is for youth. So your name. Do you identify as male, female, or other? Female. Okay. And you said you're 19. What is your address?
2792 Pete Road.
I don't know how to spell that. But. And your email?
Megan F at shaw.ca.
All right, perfect. And do you prefer for me to contact you through email or phone? Or text?
Text would probably be best.
Text, all right. What is your phone number?
250 896 0285.
Perfect. And is it okay if I do call you? Is it okay if I leave a message?
Yeah.
Okay. Do you have a home phone or just the cell phone? Okay. Are you currently employed?
Yes.
All right. Where are you working right now?
I work at a drop-in youth center. And I'm also doing a practicum.
Perfect. So I'm just going to ask first before I go into the practicum. Can you tell me about the youth center?
Yeah, so I'm a youth worker.
Mhm.
It's pretty casual. We're only open Thursday, Friday, Saturdays, 7 till 10. And basically, I go in and hang out with the youth. I'm pretty much just like a safe person for them to be able to confide in, talk to an overall supervisor of the youth center to make sure you don't burn it down. We make dinner for them, and anyone that comes by can eat dinner.
Nice. And where is this?
In Esquimalt, at the Esquimalt Rec.
Okay. And then you also stated that you're doing a practicum as well?
Yeah.
Perfect. Do you want to tell me a bit about that?
So my practicum is at Youth Horizons. It is a youth residential house where I'm, once again, like a youth worker. Same sort of, just except less casual. So I make meals for the girls, house cleaning, help them learn life skills, things like that. And then,
So it sounds to me that you have a passion to help youth.
Yeah, totally.
That's awesome. And then you're also going to school then?
Yeah, I am in my 3rd year of child and youth care.
Perfect. Are you currently in a relationship, married?
I have a partner, a boyfriend, who I've been living with for the past 6 months. So, yeah, we do, live together. We're not planning to get married anytime soon.
And that's been going on for 6 months?
Yeah.
How's that going for you?
It's going really well. We adopted another cat recently, so we have 2 cats in the house now, and one of them is, a joint cat, the other one's mine.
Amazing. And prior to you living together for the 6 months, how long have you guys been together?
We knew each other all through high school, and we started living together when we first started seeing each other again, very quickly, within the first month and a half. But we had also been seeing each other the year before,
Right.
So I don't know. We've kind of seen each other and then not chatted, and then this time 6 months ago when we reconnected, it just really seemed to stick. So we just kind of moved in right away.
Nice. Well, I'm glad that you're happy with that.
Yeah.
Okay. So how did you hear about my services?
Through the university. They had told me that this would be a good resource for me to reach out to.
All right. And okay. Was that in the Child and Youth Care program?
Mm-hmm.
All right. Alrighty, well that's awesome. I'm glad that they informed you of my services, and I hope it is a good match.
Yeah.
Moving forward, are you on any medications?
Yeah, I take Cipralex for anxiety.
I don't even know how to spell that, but I'm going to just guess, and then I'll get it later. That's the only medication?
And birth control.
And birth control. How do you find Cipralex to be helping you?
It's been amazing.
Mhm.
Ever since I've gone on it, it's like a totally different world. Like, I've lived with anxiety since I was like, since as long as I can remember. I used to have like panic attacks when I was like a small kid, where I would like throw up and like be like incapacitated on the ground. And for a majority of my life, my anxiety was like debilitating. Like, I couldn't leave my house.
Mm-hmm.
And since I started Cipralex about a year and a half ago, it has like, I just don't feel debilitated anymore. Like, I feel like I can like manage my anxiety, and I don't feel like every second of the day, I don't feel like my heart's like pumping a million miles per minute.
Did you try other medications to help your anxiety before you found this one?
No, I was actually pretty lucky.
Yeah, that's
they
amazing.
Tried me out with Cipralex and started me on a small dose, and then upped it a few times, and it's been a good fit.
That's good. And you mentioned having debilitating anxiety attacks. Can you recall how many of those you've had in your life, or is it just...
I can't even count. Like, it's been... Like, it was probably something that could happen at, like, several times a week sometimes when I was a kid.
Wow, okay. And since you started Cipralex, the panic attacks have completely gone away?
There's been the odd time where, like, I ran out of my Cipralex and, like, couldn't get to go get a new prescription. I found out that, like, you can go to the pharmacy and they can give you, like, an emergency dose or whatever for, like, a week while you wait for prescriptions. But before I knew that, I was just kind of like, well... sucks to suck, you messed up, you'll have to wait till you can go get a prescription.
Right.
And actually that, like, week was, like, the worst week I've, like, ever been, and I had, like, severe anxiety again, and started having, like, those panic attacks. So that's when I went into the pharmacy and was like, you need to help me, like, I don't know what to do, and so they gave me, like, an emergency week's worth before I got my prescription again.
Right. So you've become... like, you felt that this Cipralex is a great source for you, and just knowing that you don't have it is causing a source of anxiety for you?
Yeah, and I think also, like, my brain chemistry and stuff, like, going off of it, like, really suddenly, it just, like, my whole body totally freaked out. I've become, I think, quite reliant on my anxiety meds, but I think I'll be able to work through that and eventually, like, lower the dosage.
Yeah. So. Do you practice any other forms of coping mechanisms to help with your anxiety?
Yeah, so I try to do mindfulness. I try to take part in grounding exercises. I try to take part in self-care, which for me looks like doing things, like, my versions of self-care aren't necessarily like having a bubble bath or like kind of just like enjoying my time. My versions of self-care would be like organizing my house and like getting up to date on all of the bills I need to pay and like kind of straightening up my life so that I like lessen my anxiety. So usually when I say I need a self-care day, it's because things are becoming like overwhelming and I need a day to like get my life back on track.
Like a sense of overcrowdedness in your brain.
Yeah, and it's like I need to kind of get. Usually, I find if I get my like external space at least kind of organized and in place and clean and tidy, then like it helps me not feel as anxious on the inside.
Right, and that is definitely a good coping mechanism that is taught in multiple different practices of counseling. Is just to have yourself organized, and then that will help you feel grounded and organized in your space. All right, perfect. Well, I'm glad that you're here, that you're practicing mindfulness and grounding exercises and self-care to cope with your anxiety on top with your medications that you're on.
Mm-hmm.
I have a couple grounding exercises that we could go through in the end if you'd like,
Sure.
just because all the questions that I will be asking could bring up some unwanted feelings and emotions. So if you feel like we need to do that, then feel free to just ask me and then we can do that.
Sure.
I just want you to be able to leave and feel comfortable and not feel like anything's, there's no loose ends.
Totally.
So now that we've gone through quite a bit of information, I would like you to tell me a bit about why you're here for counseling, and then we can go into the questions that I have regarding that topic that you have.
Yeah, I think, I don't, where do I start? Last week, I've been struggling with my partner about, with my education, I feel like he doesn't fully understand, the amount of effort that goes into my schooling, and, the type of schooling that I'm doing, and, what I'm learning, and he's very fact-based, and so it just all kind of, doesn't mesh, and, I really would like to be able to talk to him about my school life, and kind of that part of me, but I've sort of had to, make a separation, and just kind of be okay, there's, school me, and kind of, home me, and I guess I've kind of just been struggling with, I feel like I'm not, a whole person. I feel like I'm kind of, these different versions of me where I need to be. But I want to just kind of be all of the versions of me all at the same time. Does that make sense?
Yeah, totally it does. So what I'm hearing from what you just said is that your partner is a bit unaware of your education, and it's struggling with your self-identity. So those are the three topics I jotted down just now: your education, your relationship with your boyfriend, and your self-identity. So out of those three things, what is the core piece that you think it's boiling down to?
I think my self-identity.
Okay. So obviously your self-identity is stemming from your who you surround yourself with. So do you want to tell me a bit about your boyfriend and maybe his background of education and why he's feeling this way about what you're learning about?
Yeah, so my boyfriend, he's an electrician.
Okay.
So very different. He went to trade school, college. Not that everything at college is trades, but his side was trade stuff, and I think sometimes, I feel maybe I don't know because I didn't actually go to college, I just kind of went straight to UVic, but I feel like UVic is more kind of academic based in some ways, not that it makes it, better than anything else, I just think they're very different types of learning, Camosun to me it seems more hands-on, and I am a hands-on learner, so I feel like that might have worked better for me actually, but he just doesn't seem to understand when I sit there and I have to do a ridiculous amount of readings, and then I have all these papers pile up, and there's APA and references, and especially him being in the trade side of things at Camosun, he just he doesn't even know what APA is, and then when I explained to him it even comes down to you have to put a period there, he's oh, no one's gonna notice if you don't put the period there. I'm no, they actually do notice, for whatever reason it matters,
right?
So I feel like he almost doesn't take things that I say seriously, probably just because he doesn't get it, he's never
right.
been in it.
Has he ever had any experience with mental health or counseling, or been exposed to any of the information that you're learning about?
Not to my knowledge, no. I think I know he has, he did have a struggling kind of time in his teens, as most teens do. He kind of got mixed up in a bit of a bad crowd and gave his parents run for their money for a few years, and then by the time he graduated, I think he just kind of aged out of that and just went and got his electrical and then smartened up. But so like in some ways, like I think he would really understand aspects that I would learn, such as like addictions and things like that. But in other ways, he really doesn't understand things like decolonization,
right?
And like big like social constructions. I've tried explaining to him like what a social construction is,
right?
And he will often just be like I'll be like, but why is that called that, or why does the world say that is the way it is? And he just says like, because it is. And like I just can't seem to get through to him about these like big concepts, which to me are like the most fascinating part of CYC.
So when do you find that you are feeling uncomfortable doing your homework at home when he's there?
I don't necessarily find it uncomfortable doing my homework. Like, he'll just sit on the couch with me and I'll put my legs up on him or whatever and type away on my laptop while we watch TV. But I find it frustrating that, like, I can't, like, discuss my homework with him. Like, I've had friends where, like, I could read them, like, a few paragraphs of my paper and be like, hey, what do you think of this? This is what I just typed while we were sitting here. And they'll be like, whoa, like, even if they don't have a whole lot to say, they'll be like, wow, like, that sounds really, like, smart. Like, I can't believe how intelligent you sound, or, like, I don't know, just kind of, like, yeah, at least they have something to say about it. Whereas, like, if I say, like, to my partner, like, oh, can I read you a couple paragraphs of my paper to see what you think? He will literally, like, get up and just start walking into another room because he's like, I'm not the one in university. Like, I don't want to deal with it.
So it sounds to me like he's a bit unwilling to take the time to learn about what you're learning about and so passionate about. And how does that make you feel?
I mean, it's something I've been working on more recently, but I think, like, at first it made me, like, angry. Like, I genuinely just felt angry, like, almost, like, belittled. Like, when he wouldn't take the time to talk about my education with me, I would literally just feel like, you don't care about this piece of me, or, like, why don't you see the importance of my education and all the effort? But now I think I'm just starting to realize, like, it would be nice if he would want to take part in some of it. But at the same time, like, my sister said she's had a similar problem with her boyfriend. She was in this degree where she just kind of had to accept that some people just might not get it in the way that we do. And that's why they aren't in CYC like we are. And there's some points of, like you can't force someone to get it if they don't want to get it. So I've kind of just been learning to accept, like, maybe some aspects of my degree I can bring up that he might get, but other things I'm just going to have to, like, accept that he's not the person I have to talk to about that stuff.
Right. So what I'm hearing from you, like, initially I brought up, like I said, education, boyfriend, and self-identity. But now, after that discussion, I'm seeing that maybe a goal would be, like you said, you wanted to work on your self-identity. Maybe just we could set a goal for being able to find ways to incorporate your boyfriend into your self-identity and work and be able to have those comfortable conversations and allow space for him to learn, like, openly about what you're learning about. All right, so I will write that down as your goal. And obviously, if that changes, then we can always work through that and adapt. But like I said, what I'm hearing from you, that seems like it's a really big part of your relationship that you want to be able to work on. All right. Well, thank you for sharing all of that information with me. We're now going to start these questions that I have. There's 18 of them, so if you ever need a break, just let me know. Do you have any questions before we get started? You feeling comfortable? Okay. So the first question I have that you've already answered is that it says, have you seen a counselor or psychiatrist before? When, why, was it helpful? What were the issues? So you said that you have seen one or a couple. You said And has it been like an ongoing thing, or did it start at a certain age?
It's been pretty ongoing. So my first family therapist that saw me and my whole family, I was like 5 maybe.
Okay.
And then, I saw school therapists and lots of different talk therapists throughout from that age until like my teen years. And then once I hit my 20s, that's when I started like the EMDR therapy and moving into more scientific-based kind of things.
Right. And you said the most helpful was the talk therapy for your own personal growth, or are you thinking in perspective of like your whole relational practice with like your whole family and people in your lives?
I'd say the talk therapy and the EMDR, they were both actually pretty beneficial.
Okay.
I think the EMDR helps me kind of have these like aha moments of like I don't need to hold on to things so tightly, and the talk therapy kind of helped me like work through the emotions that like came unraveled from that. If that makes sense.
Yeah. Were there any issues that were brought up in these two, in talk therapy or EMDR? Like, it seems like it was a very positive experience, but was there ever a time where you felt like something was unanswered, or you were feeling uncomfortable, or?
No, I don't think so.
Okay. Are you on probation or involved in the legal system?
Nope.
Right. Perfect. And then you're here voluntarily, obviously.
Yeah.
Are you currently in a counseling process with another agency or professional group?
No.
Nope. So when did you finish your talk therapy and EMDR?
My talk therapy went until just at the beginning of summer.
Mm-hmm.
I'd say like June.
Okay.
And then my EMDR finished around August.
Yeah. And about how many sessions were both of those, or about how long of a duration?
The talk therapy, I was seeing the same lady for like 2.5 years.
Mm-hmm.
So we had built a very strong connection, and it was just kind of one of those, like I feel like I could have gone and seen her forever, but it was one of those relationships where I think we had come to kind of a plateau of like, okay, we've met goals. I think like our relationship had done what it could do. And the EMDR was, because of just the way EMDR is set up, I think it was like a total of like 20 sessions or something like that over the span of like 6 months.
Okay. Have you talked with your family doctor or another psychiatrist in your previous sessions about any of the concerns that you brought up regarding education, your boyfriend, or self-identity?
I have talked a little bit before about feeling like my partner doesn't like get kind of other pieces of me.
And how did that work out for you?
I only had one session on it,
Mm-hmm.
and wasn't able to stay connected with that organization, so it kind of just remained unresolved.
So from that one session, did you feel like any of your concerns were answered?
I think that's when I was able to start coming to the realization that, like, people are who they are. Like, you can't force them to want to understand things, and at some point it's like you either have to decide if these are values that are like that I can't give up, or if these are things that I'm okay with him not getting. That makes sense.
What I'm hearing from you is the ability to accept him for who he is.
Yeah,
totally. Do you have a family doctor? I'm not sure if I already asked that question.
Yes, I do.
And when was the last time you seen them?
A couple months ago, I think. I went in just for another prescription.
For your...
For another prescription.
All right.
Both of them.
Perfect. And then the next question just regards to medications. This says, are you on any medication for emotional reasons or physical conditions? We already went over that. What are they used for and how long have you been taking them? So we've already covered that. You said a year and a half. And then your birth control, how long have you been on that for?
Since grade 11. How many years? 6 years?
6 years?
Yeah. Wow. Yeah.
So, next question is, have you ever been diagnosed with a mental illness? What was the diagnosis? And have you had a psychiatric hospitalization? So you said that you have anxiety. Did you go to your family doctor and go through the testing of that?
Yeah. So I have pretty severe anxiety.
Mm-hmm.
It's definitely a step up from generalized anxiety, they said. And I also have been diagnosed with PTSD.
Do you want to speak more about those diagnoses?
The anxiety, I don't know, I was just born that way.
Right, and you already mentioned that whole process.
Yeah, and then just my PTSD, is rooted from a domestic violent relationship, so, which is why I did, the EMDR, and it really helped me work through that, which was awesome. I think the PTSD is slowly a diagnosis that's fading away almost because I've done so much work on it. So.
And how long ago was that relationship?
That relationship ended 2.5 years ago.
Okay, quite a while ago.
Mm-hmm.
Do you have any feelings in your body when I ask those questions about that experience in your life?
No, I think I've worked through it.
Okay.
A solid amount to the point that and that's partially what the EMDR was able to do for me. I think when I look back at that point of my life, I just kind of see it as a stage of my life and just a piece of kind of what has gotten me here, but
right.
I don't feel as emotionally impacted by it anymore.
Well, that's great. I'm really glad to hear that counseling has really helped you work through that experience.
Mm-hmm.
But if you ever do feel like you're having a traumatic experience or things are ever being brought up for you, feel free to say that you don't want to talk about it or that we can unpack it or whatever you want to do, however you're feeling in that space. Have you ever been hospitalized for your panic attacks or anything?
No.
Can you give me an example of what would happen with the people around, were people around you when you were having these panic attacks?
Usually the panic attacks were triggered by, I was going to say angst, but of course they were. They're triggered by usually my anxiousness came about when I felt abandoned or alone, if that makes sense. So my panic attacks got really, really bad when I was a kid and I was separated from my parents. And I lived with my aunt and uncle for a while. And when I was separated from my mom, I used to get in my head about wanting to see my mom. And then before I knew it, I'd be a ball on the floor.
Right.
And would throw up and stuff. So, and the other times that I remember having pretty severe anxiety attacks or panic attacks was when my aunt and uncle would go away on business trips and hire nannies to look after us.
Oh, okay.
And it was that same feelings of the abandonment
right.
and being alone, and it just triggered panic attacks again.
Stemming from people leaving you that you've built trusting relationships with.
Definitely. I think it's that piece of trust. When it's someone that I have that, I tend to kind of cling to people when I have that really firm bond with them.
Mm-hmm.
So then when that person that I've really clung to and bonded with, like, leaves, that's when it triggers.
And then how would you feel when they would come back?
Like, ridiculous. Like, it's like, once they come back, I'm like, wow, was that really necessary? Like, it's all, once I feel like I'm not in that place of, like, abandonment anymore, I think I can, like, really think logically and be like, wow, that was ridiculous. You did not need to freak out, and it's not so-and-so's job to, like, never leave because they have to be with you all the time, and, like, all the rational thoughts.
Right. So it sounds to me like you had a sense of relief when they would come back, and you were able to see that as a teaching moment.
Mm-hmm.
Yeah, totally. That's good. All right. So we've kind of already touched on this one. It says, do you think depression or anxiety / panic attacks are a problem for you? But it seems like you've definitely been able to cap your anxiety and panic attacks through the use of medication.
Totally.
So on a scale of 1 to 10, 10 being the worst, that it's not under control, and 1 being the best, where would you rate yourself?
Right now, I'd say it could fluctuate between, like, I think the worst it could get with, like, me medicated and stuff right now would be, like, a 4.
Okay.
And the best it usually, like, on a day-to-day basis, I'm usually at, like, a 1 or a 2.
Okay, that's amazing.
Yeah, so it's improved, like, crazy amounts.
Right. So can you tell me about what a day out of 4 would look like?
I'd say a day out of 4, it might seem kind of extreme for a 4, I guess, but because my anxiety was always so extreme, for me, like, a 4 is just, even when just me not wanting to leave the house, which I think some people misinterpret as, like, depression, but for me, it's, like, sometimes I feel so anxious that it gets to the point that I just, like, don't want to get up. Like, getting up and trying to, like, function and leaving the house is, like, it just makes it, like, worse. Like, I think when I get really anxious, I just want to lay there and sleep, because then, like, when I sleep, my brain shuts off.
Right.
And then I wake up, and I'm usually kind of like, okay, I feel better now, and I can move on.
So what I'm hearing from that, it makes me, it brings up the question if you've ever had any signs of depression in your life as well, because typically anxiety and depression can go hand in hand.
Mm-hmm.
And a symptom of depression is sleeping a lot.
Yeah. I think I don't worry with depression. I mean, I know spunky, happy people can be depressed too, but even when I've done, like, my evaluations and I've gone in to see psychiatrists and stuff, through all of the evaluation forms, they're, like, even for me when I'm reading them, there's, like, such a big draw. Like, I always feel like I don't even resonate with, like, the depressive feelings. But whenever I'm looking at, like, the symptoms of anxiety and I'm doing checklists and filling things out, like, even after, if I'm unaware at the time of doing it, like, I could put down, like, 0 for feelings of all of the depression things, even if I didn't know. And then all of the anxiety signs are, like, 5 out of 5.
Right.
So I think, yeah, I've really kind of learned that it mainly just is the anxiety for me through, like, seeing professionals.
What I'm hearing from that is that the anxiety piece is more from, like, a socialization aspect.
Yeah.
Where you're just feeling like you don't want to go outside because it can be too overwhelming, which relates back to your practice of self-care. You're being mindful and understanding what your body needs, and you're reading how you're feeling in that exact moment.
Totally.
Does that sound right?
Yeah.
Perfect. And how do you feel about, like, how is your anxiety right now talking about all of this? This is obviously bringing up a lot of things, and social, like, the conversation that we're having can be triggering, especially if it's a socialization aspect of your anxiety.
Yeah, I think I'm feeling good right now. Maybe just because I've dealt with my anxiety for so long, it's not really a hard thing for me to talk about anymore.
Right.
I feel quite, like, comfortable in it, and especially since, like, like getting a handle on it, like since starting Cipralex and like acknowledging that like I have bad anxiety.
Yeah.
I just talking about it doesn't seem hard for me anymore.
And with your previous experience with therapy, what I'm understanding from all of this is that you've made therapy a safe space so that you're comfortable with speaking about that. Is that correct?
Yeah, totally.
So that was the anxiety, and then the depression scale 1 to 10. Is that about a 0 then? That's what I've heard you say on those sheets?
Yeah, I don't feel any depression really at all. I mean, I get sad, but I wouldn't call it depression.
Right. Do you have problems with sleep, appetite, weight, and other health concerns?
I used to have pretty unhealthy sleeping habits, so I would stay up pretty late. I would always fall asleep. Like, I would never actually put myself to bed. I'd just, like, sleep on the couch and then kind of, like, wake up at 4 a.m. and be like, oh, I should go to bed. And so after realizing that was having, like, a pretty big impact on just, like, my day-to-day living, like, not having a good sleeping habits and hygiene, I started making sure that, like, if I start to feel tired, like, even if I don't feel like it's that late, I need to go to bed.
Right.
So I do things like that now. When I get really anxious, I tend not to eat. Or sometimes when I'm really anxious, I will, like, self-comfort with food. So I think it just kind of depends on the type of angst. Like, if it's, like, a sad angst, like, for instance, if someone, like, I feel abandoned,
right,
I'll, like, order myself, like, my favorite kind of food. Or sorry, no, I won't eat at all. But if I'm feeling that kind of anxious, like, I don't want to leave the house, and I'm, like, just not wanting to socialize and everything feels overwhelming, that's usually when I eat, like, comfort food.
Right.
So, yeah, I think it depends on the type of anxiety. But I'm also noticing more recently that I'm putting on what seems to be, like, a healthy amount of weight.
And how do you feel about that?
At first it kind of sucked because I've always been, like, really skinny. Like, I've always been really petite. Like, my whole life I was just a very, very small person. And it started when I, like, posted a picture on Instagram, and my mom or my cousins were like, oh, you look like you put on a bit of weight. And then, like, my mom came out and visited me and was like, yeah, you've definitely put on a bit of weight. And, like, everyone's like, no, it's super healthy weight. Like, it looks awesome. You look really healthy and fit and, like, this and that. But I think what scares me is, like, if I've put on the weight so fast, like, I keep putting more weight on.
Right.
Like, it's like, if it took me, like, a short amount of time to get to a healthy weight, it could take me a short amount of time to start getting to, like, unhealthy weight, which, like, freaks me out.
Yeah. But what I'm hearing you say is that it's a healthy weight, so it seems to me that you've come to terms with it and you're accepting who you are.
Yeah. I would like to hopefully keep it at this weight, though. Like, I think if I started gaining even more weight, I'd be like, okay, that's enough.
And those could be some sort of technique that you could add into your mental or your self-care routine as ways to compensate for the food that you're having to comfort yourself during those high anxiety moments.
Yeah,
totally. Do you have any difficulty with concentration or attention?
Not really. No. I actually find that my anxiety is a pretty big boost in me kind of keeping my attention in a lot of weird ways. Like, because I get so anxious about things, I'll, like, focus in on stuff, like, really easily and just, like, get it done because my anxiety is, like, pushing me to do it.
So it's used as a strength in that sense.
Yeah, it really does help me. Like, my anxiety keeps me on top of things, and I always have papers done, like, a week early because I'm so anxious about them.
Right. Well, that's good that you're able to see your anxiety as a positive and help improve your life as well and not just hinder it.
Totally.
do you use any drugs or alcohol?
I mean, I'm of age, so I do drink casually.
Mm-hmm.
I've smoked weed the odd times. Kind of odd, I feel, to be, like, open about now that it's been legalized.
Mm-hmm.
But I'm like, oh, it's legalized.
Right.
So, yeah, like, I definitely dabble, but I wouldn't say, like, any substance abuse with either of them.
Okay. So about how many times a week would you say that you drink or smoke weed?
Drinking, I usually will drink on weekends.
Mm-hmm.
So, like, if I know I don't have... My rule of thumb for drinking or smoking weed will usually be, do I have a paper to write? Because if so, gotta be sober to write papers.
Right.
Do I have to go to classes? Like, do you have work or practicum later that day? Because obviously if you do, then you can't be doing that kind of stuff, like, earlier in the day.
Right.
So my sister always, like, when I started becoming a teenager, she always said, like, appropriate times and places.
Totally.
And I think that's just, like, really stuck in my brain. I'll, like, evaluate what my whole day looks like and be like, this is an appropriate time to do it.
Yeah. Well, that's good. It seems like you've got a good understanding of when and where to do it, and it's not a concern
Mm-hmm.
that we need to engage in that conversation. So what I'm hearing from that is that you don't have it leads into my next question, that you don't have any addictive behaviors, especially if you're able to put limitations on when you're engaging in substances and setting your priorities.
Yeah, I think with those two, I seem to really not have any addictive behaviors, but I do also smoke. So I don't really know where that comes into play. Like cigarettes. So, I mean, nicotine-wise, I definitely have become addicted to nicotine. But it seems to be like that's the only substance I've ever gotten hooked on. I've wondered maybe if it's because my dad smoked when I was a kid, so, like, it's familiar. I don't know.
Right. Have you ever thought about trying to quit that?
I did quit for about 5 months in January of this year. And then I think it was like I went out for drinks with friends or something, and somebody offered me a smoke, and I just was like, sure. Because, like, we were drinking, and it tends to make you a little bit more like, woo, whatever.
Yeah.
So I had a smoke, and then the next morning I just woke up and was like, oh, wow, I could go for another smoke. And then it just started again.
Perpetuated the cycle.
Yeah. I do feel good knowing that I was able to quit for 5 months.
It gives you the confidence to know that you can do it again.
Mm-hmm.
Are you having any thoughts of suicide?
No.
So back on that scale of 1 to 10, for current suicidal ideation, you would say it would be at a 1, being no thoughts at all?
Yeah.
Have you ever attempted suicide before?
No.
Mm-hmm. No previous. Can you tell me a bit about your family and, like, what were some strengths or challenges that your family had?
I grew up in a pretty, like, abnormal family, I would say. My dad's in the military. He's a chief. It seems normal, but it wasn't. My dad's in the military. He was a chief. My mom's a labor and delivery nurse. And then I had a brother who passed away. And after that, it triggered a lot of mental health with my mom. And it triggered borderline in her. And so then my mom had tried to commit suicide when I was young, went into the hospital, and then because my dad was in the military, so he wasn't home a lot, like, he was always being shipped away, so that's when we moved to Calgary, and I lived with my aunt and uncle for a while. Mm-hmm. Me and my middle sister, we were, like, the two of us got moved around together. My oldest sister, when I was 8 or 9, she emancipated herself from the family, so Now we have quite a good relationship and we see each other, and she's part of the family. She talks to my mom. But at the time, she definitely disappeared from the family for quite a while. Yeah. It was just a lot of moving around, I think, and a lot of confusion. Like, when I was young, I just, like, did not understand, like, what was happening. It's like 1 second Dad was there, then Mom was there, then Mom was gone, then we were in Calgary, just...
So what I'm hearing from you from some of the challenges that have come up is mental health concerns with your mom, not able to understand what's going on in your own surroundings, your dad being away with military. But out of all of that, I'm hearing that your family is really resilient and able to cope through lots of hardships.
Yeah.
So it's really great to see that you guys are all still able to get along and work through these experiences together.
Totally.
Are your parents still together right now?
No, they're separated. Yeah, so like around the time that my mom had tried to commit suicide, that's when she divorced my dad essentially.
Okay.
And then she moved to Calgary to be closer to my sister and I, who were living there with her sister.
Mm-hmm. And how is your mom doing now?
She's doing really well. It's crazy for me to think of like where she was then, and now, like when people say like you are the only one that can like make a difference in your mental health, and you have to want that change. So true. I mean, her sisters and my dad like put her in the hospital, and she was locked up in psych wards for like at least 1.5 years, 2 years. And then even when she was let out, she would go missing lots of things, and it wasn't until she finally took it upon herself to go to DBT and CBT and get herself a round-the-clock therapist that she can call, and just really accepted, like, okay, this is who I am.
Right.
I'll have to deal with it. And so now she's amazing. And I remember even being, like, I think I was 10 or 11, and I went out to visit her, and she took me in to meet her therapist so that, like, all three of us could talk about her mental health, and that way I would, like, I could ask questions and totally understand, like, what was going on with my mom.
How long ago was this?
When I went in to talk with her therapist and her, it was...
No, when your mom started, like, her mental health started deteriorating.
It was when I was around 9, so that was, like, 12 years ago.
Okay. And how's your relationship with your mom now? It seems like...
So good.
Very healthy, yeah.
Yes, she is like my number one like support and help, and she always has this line that she says to me like whenever I get anxious or I start panicking about something, or I'm just like having a bad day and hyperventilating, and I'll just call her, and she always says like, Megs, don't forget, I will never let you fail at anything. I will always like be here to like support you, and like basically just having someone say like, I will never let you fail. Like that is just like the most like knowing you will literally, if at any point you feel like you're failing or things aren't going right, like I can call my mom and she'll be right there to like help me out.
That's amazing. Yeah. And even when I just asked you that question, you lit up and you were so happy about it.
Awesome. I love her so much.
This next question, what is your life like now? You've kind of told me about it. You're going to school. You are working with youth, and you're also doing a practicum with youth. You're living with your boyfriend right now. It seems like it's going really well. Just with regards to the dynamic of the relationship, but there are areas that you want to work to improve, just with him being open to learning about your school and stuff. So it seems like you've definitely got a good base of where you are trying to go. This next question also we've kind of already covered. It says, what is working in your life? What would you like to know? What would you like more of in your life? So it seems like therapy was working for you, going to school is working for you. your mental or your self-care mechanisms are definitely working for you?
Yeah, I think the main thing that I'd like to incorporate more into my life would be hobbies. I used to be like a competitive dancer, a cheerleader. I was a competitive gymnast. Always on any like athletic team when I was in school. And since graduation, I've really which was already 5 years ago, I've really stopped taking part in those like athletic hobbies. Like not out of like trying to, I just kind of am really busy, and when you're trying to pay rent and get an education, it falls on the back.
Totally. Yeah. So what are some areas that you would like to do as a hobby?
I have, over the summer I was thinking about trying out for like the UVic Vikes, like the cheer team. But then I ended up actually hurting my shoulder really bad doing a summer camp thing with kids. One of the kids fell on me. Oh. Yeah, or like plowed me into the ground, and I like really severely hurt my shoulder. Got a rotator cuff injury and a bunch of like soft tissue damage, so couldn't do that. But it's starting to feel better. And I've been I know there's a place in my neighborhood called Pole Tricks, and my boyfriend thinks it's so ridiculous because it's like, essentially like, it's like pole dancing, like that's what it is. I think people think of pole dancing as like always being strippers. Yeah. But like it is just like another art form.
Art and exercise.
Yeah, exactly. And it, I think, really focuses on all the aspects of like dance and gymnastics that I love, like the flexibility, being able to do like cool tricks, like generally being good for your body, just kind of all of it. So I think I'm going to go and try that. It's something like an art form of dance and flexibility I've never tried. Yeah. I've tried aerial silks before, and I really liked them, so I think I'll probably like this.
So what I just heard from you and what I wrote down is that maybe we could make it a goal for you to sign up and do at least one class at Pole Tricks. Yeah. All right. Yeah. I think that is something good. And, you know, in the next couple sessions, we could even bring up their webpage and we could look into it, or even other types of art or exercise that are similar to that we could look into.
Totally.
What will you do between now and the beginning of your counseling in support of yourself? So from now until our next session, what is a goal that you want to set for yourself that we can discuss next time?
I think a goal would be to at least look into a hobby, or set a time. That's something that would be like really important to me, finding that kind of self-identity again. So I think even like whether I find the information on it and sign up at least, or even if I like figure out a time in my schedule that I'm like, okay, I'm going to find some sort of class that I can do because it fits right here. Right. One of those. Try to start figuring it out.
And you just mentioned actually that sparked an idea, is that at the beginning you said that you were working on self-identity and self-discovery, and then you spoke about all these hobbies that you used to do. So you had mentioned that finding a hobby that will help navigate your self-identity now will be a good goal as well. Yeah. Totally. So it's not only working through your self-identity within your home and within your relationship or within school, it's with who you are and how you are in this world. Yeah. That is awesome. Well, I think that is definitely an achievable goal, and we can definitely work through that through our next session. Cool. And then kind of the next question goes into that. It says, what changes do you wish to make? And then what is your goal for coming to counseling? So, like I just said, it seems like you're wanting to work on self-identity and how you are in the world. Yeah. And then, so what are some exact changes in relation to self-identity are you hoping to make?
Focusing just on, I think I want to just learn more about like myself. Like, I feel like when I was a teenager, I knew like I like to dance. These are my favorite types of
Right.
dance. I know that A, B, and C make me happy. Like, I knew what my favorite type of music was. I knew what game I wanted to play with the family. That was, like, my favorite family game. Like, I had all of these things. I knew exactly what my favorite type of food was. I feel like I knew myself.
Right.
And now, even right down to, like, once you get older, like, your taste buds change. You start to like different tasting foods. And I'm realizing, like, oh, I don't really like all these kind of bland foods I liked before. I like more exotic things. And then it's like, oh, well, I feel like I've been missing, like, that dance piece of me. And it's like, I just feel like I'm kind of, I need to, like, find myself again. And I really just want to know, like, what I like and what I don't like, and, like, what truly makes me happy, not just, like, I think sometimes like, going out for a walk with your partner is something you should do because so many people post pictures of them, like, out on trail walks with their partner. But I actually really don't like going on walks. I don't mind it if it's the right place. It needs to usually have some sort of a pretty destination at the end of it. I don't just like walking on, like, those boring trails set in, like, Goldstream or something. I mean, Goldstream's actually quite beautiful, but you know what I mean? So yeah, I think I just want to, like, figure out what I actually like and not just, like, what the world tells me I should like.
Totally, yeah. And from what I was hearing at the beginning with your schedule, going to school, being in a practicum, having a job, juggling, you know, paying bills and keeping your house clean, finding yourself can be a really difficult time being that busy because you're not taking the time to listen to your body, listen to yourself.
Yeah.
Which is where the role of you practicing your self-care routine will definitely be beneficial.
Totally.
So I think we've finished all of my questions. How are you feeling after answering all of those? Because we dive pretty deep into who you are as a person and your goals and intentions of counseling.
I think I feel good. I feel a lot more clear also about, like, what I want out of this. Like, I think when I first came in, I was kind of like, what do I want out of this? I don't know. I know something's not quite right. But now I'm kind of like, wow, I feel like I really have, like, a goal that I'm, like, excited about. So.
Yeah, that's exciting. So I'm just become aware of the time. So I'm just going to quickly go over, summarize what we've just done, and then we can set up what we want to talk about next session.
Totally.
So this week was kind of just primary on me learning a bit about yourself, what you're wanting to take out of counseling. So some of the goals and intentions that we have spoke about is your education, your boyfriend, and your self-identity, with your self-identity being the major goal that you're wanting to talk about. It's rooted in hobbies that you want to take part in, and just focusing on who you are as a university student with a job and a practicum and life going on. So just figuring out who you are in this world is something that we can talk about. We can do lots of exercises on that. Is there anything that you feel I've missed out of that?
No, I think it's great.
All right. So for next session, I'm going to give you a little bit of homework. I just want you to maybe take 1 hour or something within the next week to really just, like, take the time for yourself, focus on yourself, learn something that you want to do, look into the poll checks, and then we can go from there. We can see how that 1 hour helps your anxiety or your relationship, your self-identity. Maybe you find something that you really like within that hour about yourself.
Yeah.
And then we can speak to that. Does that seem like an achievable goal for next week?
Totally.
Perfect. So before we finish, I just want to make sure that you're feeling comfortable and you're not leaving here going to feel all flustered or have any brought up unwanted anxiety.
Yeah, no, I feel great.
Okay. So did you want me to give you these grounding exercises just in case something gets brought up while you're heading home or within the next week?
Sure.
Oh, right. There you
Awesome.
go.
Thank
And all the
you.
instructions are on them, so you can just read them out. And then if you have any questions regarding those next week, we can go over them.
Totally. Sounds good.
Awesome. Well, it was so great to meet you, and
Yes.
I can't wait to help you achieve those goals that we've set up.
Awesome. Thank you so much.
You're welcome.